A study conducted using UNICEF South Africa's free U-Report SMS platform says only about 55% of young people in South Africa say they will get a COVID-19 vaccine. The UNICEF platform received more than 5,000 responses, with 75% of those from young people aged up to 24 years old. Joining us to find meaning in the numbers is UNICEF South Africa's representative, Ms. Christine Muhigana. A very good afternoon to you, Ms. Muhigana. Good to have you on the Daytime Update today. So tell us about what your research shows as perhaps the reasons why young people are only willing to take the vaccine at a rate of only 55%.
Thank you. Thanks for having us and for the opportunity to share the results of this poll. Firstly, what I would like to say is that young people over the age of 18 have really brought new momentum to the COVID-19 vaccination rollout since they became eligible, as you know, a little bit earlier than planned on the 20th of August. So what this poll is actually trying to do is providing more insights as to the perceptions of young people on the COVID-19 vaccine deployment, so that it can better inform, our collective response going forward. So what the poll is actually telling us is that young people who continue to be hesitant are so because they fear or they hesitant about the actual safety of the vaccine and possible side effects. So actually the major dimension seems to be fear of side effects, and then after that, the actual effectiveness of the vaccine. So it tells us, what it is that we have to work on in terms of the credible information that we get to young people and to as many as possible, and preferably, among them, young people reaching out and influencing their peers.
Did your research gauge exactly what young people know about the vaccine and their level of knowledge regarding it?
Right. So this is a poll, actually, not so much a research. And what the poll is telling us is that more young people than more young people than those who say that they would take the vaccine know the benefits of it. So 86% of those who were polled were saying they know that it would be good for them, for their health, it would protect them, but yet they remain hesitant. So I think it's not that I think, it tells us that we need to work on those factors, which is credible information on the actual safety and the effectiveness on of the vaccine that need to get to as many young people as possible. And there, in turn would share that information with people around them in the community.
And what do young people use as their source of news and information regarding COVID-19? Which platforms do they find credible?
Absolutely. Thank you for that question. So the poll tells us that they have most confidence in traditional TV and radio. So that's 30% of them. And the second, source of credible information for young people, or those at least who were polled, would be health workers at 36%. And then social media, slightly behind at 13%. So that really shows us how important it is for media like you to provide facts about the COVID-19 vaccine, because young people are listening, are watching you.
It's interesting
and find you credible, of course.
It's interesting that social media only accounted for 13%. Was it a bit of a surprise for you Did you think that maybe social media platforms had more credibility than what this poll actually shows they have?
Well, it's revealing. I'm not sure if we were expecting that the social media, would be more credible. We know that young people are more on social media than any other category of people in the communities or in the population. But whether they believe that such information is credible is something else, and I think we actually gratified by the fact that they lucid about what's on social media and tell us that what's on TV, traditional TV and radio is something that they would be more inclined to believe as being credible, as being true, over and above what's on social media.
If you could talk us through some of the campaigns that UNICEF is working on in conjunction with provincial as well as national government and other partners to, I guess, raise awareness to young people about COVID-19 and vaccination.
Absolutely. So we launched a campaign called Myth or Vax with TikTok. It's an Africa-wide campaign. So we're doing it with TikTok, one campaign, the African Union, and this is to counter myths and disinformation about COVID-19 vaccines. Particularly on what's the amount of information that's unfortunately on social media that we would want to help counter. We also, with the support of UNICEF youth volunteers, leading a campaign called Grandkids for Go-Go's. They assist elderly in their communities with vaccine registration. Another thing we're doing is engaging communities through a UNICEF South Africa multimedia truck activation. You may have seen it on the road or on media. And this brings messaging and also information on health services directly into communities. We have people from members who are members of communities talking back to people in their respective communities, so that we are able to influence, pass on the important messages around how COVID-19 is prevented. Through the vaccine drive, but also, continuing the non-pharmaceutical interventions, masking, distancing, and washing hands. And then we're also working with community radio stations so that, we actively engage young people in programming with open discussions on the COVID-19 vaccines, and also broader issues, related to the prevention of COVID-19 in communities and more broadly, in the country.
Ms. Muhigana, thank you very much for that update and the work that you're doing as far as discerning and deciphering where young people are at regarding COVID-19 and vaccination. That's Christine Muhigana from UNICEF South Africa representative.